Hello, my name is Frances Alred, and today is October 18th, 2020. I am a student at TCAT, and I'm going to be performing the apical pulse. Okay, so I'm going to start off by checking the patient's orders and checking the protocols, and then I'm going to identify the patient using two identifiers. And I'm going to wash my hands and gather my equipment. So I have my stethoscope, and I'm going to um, make sure that they're not on any medications that are going to affect their heart rate. And I'm going to explain the procedure to the patient and provide privacy. And if needed, I'm going to raise the bed to a comfortable height. So then what I want to do is make sure the patient is in the correct position. So he is sitting up. And then I want to locate the apical pulse, which is in the fifth intercostal space along the mid-clavicular line. But first I'm going to loosen the gown so that I have access to the pulse. So we're just going to follow this here, his clavicle, and I'm going to go down, and I'm going to find the fifth intercostal space, 2, 3, 4, and 5, so just below that nipple there. And I'm going to palpate the pulse. Then I want to make sure that I'm placing my stethoscope directly on the skin. And I hear my sound 1 and sound 2. I'm going to count for 1 minute. Alright, so I got 65. Now I'm just going to make sure that the radial pulse and the apical pulse are matching. And they match. So now I'm going to make sure that My patient has their call light and the bed is lowered back down to the floor and they have all their things that they need next to them. I'm going to make sure that they're comfortable, and then I'm going to wash my hands, and then I'm going to go back and look at their chart again and evaluate my findings and make sure that it matches what is in the chart.